Is aspirin an adjuvant cancer therapy? Well, Aspirin clinical trial was made and published in 2016 to assess the aspirin effects on disease recurrence and survival. So 4 parallel cohort studies were designed on 4 non-metastatic solid tumors. Inclusion criteria implicated invasive breast cancer, non-metastatic prostate, colon or rectal, esophageal or gastric adenocarcinoma. Another criteria based on primary treatment with curative intent, whether it was surgery, chemotherapy, or radiotherapy. There was also common exclusion criteria. Patients shouldn't have history of predisposition to aspirin toxicity, and of course they aren't using aspirin, NSAID, or anticoagulant currently. Methods comprised of 7 stages. Registration was done in cancer research centers in UK and India with large sample size. Patients take 100 mg of aspirin per day for 8 weeks in run-in period, which was before randomization to assess tolerance and adherence. Randomization was double-blinded, performed separately for each of cohort. Follow-up period continued about 5 years, included cognitive assessments, questionnaires, blood tests, tumor samples. And for toxicity management, immediate discontinuation for patients with severe toxicity which related to any aspirin such as GIT or intracranial bleeding, hypersensitivity, etc. Investigators managed toxicity under the assumption that participant is receiving highest dose of active drug and no need for unblinding. Size and diversity of the study shows secondary research questions about methods to measure adherence other than verbal. Does aspirin protect against cognitive decline, or is the data collected through the trial as accurate as routinely collected data in hospitals? Transitional goal is that sample storage in cancer and biobanks for further research. For future work, we should ask which groups would benefit more from aspirin use, and what are the anti-cancer mechanisms of aspirin? Results came finally hopeful, as outcomes showing tumor size and specific primary analysis will take 5 to 6 years after recruitment. Overall survival is secondary outcome after 15 years. Long-term use and large sample size help realize aspirin benefit. Good ethical consideration as a study of clinical practice and depends on